Welcome to Salina Regional's Morning Medical. I'm Mike Maddock from Salina Regional Health Center. With me this morning I have Dr. Scott Boswell. Dr. Boswell is the newest addition to Salina Regional Neurosurgery. Well, welcome to Salina and welcome to the practice. I know now with the addition of three neurosurgeons, what does that mean as far as, coverages and whatnot?
Well, so there are 3 neurosurgeons now in Salina, which offers the capability to provide patient care in all of north central Kansas and Salina in particular for anybody who has some sort of traumatic event, whether it be traumatic brain injury or traumatic spine injury or something like that. They now have the capabilities of being treated here in Salina, whereas in the past they would have to travel far away from their home. Now they have the ability to be treated here closer to home, which is easier on families and even the patients themselves as they're coming back for follow-up and that kind of stuff. So it can be really beneficial for those kinds of patients.
Well, as well as trauma, there's obviously other things that the neurosurgeons do.
Sure. So besides just trauma, there are other capabilities that our practice has, whether it be cervical spine pathology, arthritis, and disc herniations and that kind of stuff. And the cervical spine is the part of the spine in your neck. The thoracic spine, which is the part of the spine which is in your chest cavity, as well as lumbar spine, which is your lower back. And so we really have the full spectrum of capabilities here in Salina as far as spine surgery. We also have the capabilities of doing brain surgeries, whether it be brain tumors or other sorts of pathologies within the brain. As well as other capabilities such as peripheral nerve pathologies, anything that involves the central nervous system. So peripheral nerve pathologies, carpal tunnel, cubital tunnel syndrome, and that kind of stuff.
Now, we were talking about this earlier, and anybody who's seen my golf swing know I'm just a back injury waiting to happen. What about the weekend warrior types, the softball players, the classic back injuries? Sure. At what point in time does a neurosurgeon come into play?
Well, the nice thing about the weekend warrior and those types of back injuries is that in people who get acute onset of low back pain, 50% of back pain will resolve within a week, and 90% resolve on its own without any treatment or anything like that in 12 weeks. So 90% will improve on its own in 12 weeks. It's those other people that don't get better. Those are the people that need a workup and treatment and possible surgery if that ends up being indicated in them.
Thank you very much for coming on the show, and welcome to Salina and welcome to your practice.
Thank you.
And thank you for watching. For more information, please visit srhc.com and also like us on Facebook for the latest updates and news.